Hello my dear. Today on this video we will learn two very important X-ray tests. This is the first one. Dear audience or dear learner, at first you will try yourself to describe the X-ray on the screen by pausing the video within 20 seconds. Remember, in our academic station in the exam hall, to decide regarding the diagnosis of the X-ray or ECG, you will get maximum 20 seconds. Maximum 20 seconds. So here is the like the academic exam hall station, and by pausing the video you will try to at least to make the diagnosis by 20 seconds. So start now. Okay. So hope you have made your diagnosis. Now describe. This is X-ray chest PA view showing trachea is central in position and both the lung field is quite normal, no bony deformity, no soft tissue abnormalities seen. Right costophrenic angle is obliterated. Okay, this on. Actually the right costophrenic angle should be like this, but this angle is obliterated or obscured, whatever you say it is. And the most important finding is the mediastinum is widened. That is the mediastinal widening. Okay, this is the mediastinal widening. It is not cardiomegaly. Some of us will describe it as the cardiomegaly. Actually it is not a cardiomegaly. Rather it is a case of mediastinal widening. So the aim of this presentation is to make sense regarding mediastinal widening, not cardiomegaly. So now the question is, the next important question will be, what is the diagnosis? When your teacher will ask what is the diagnosis, then the answer will not be a specific diagnosis. Actually you will say like this: I have some differential diagnosis. So what are the causes of mediastinal widening? The most important one is lymphadenopathy. Okay. That means mediastinal lymphadenopathy. Number 2, malignancy. It may be bronchogenic carcinoma. And number 3, it may be aortic aneurysm. Very unlikely. So now at first I have said that the lymphadenopathy, mediastinal lymphadenopathy. So what are the differential diagnoses or what are the causes of this lymphadenopathy? It may be lymphoma, it may be leukemia, it may be tuberculosis, it may be sarcoidosis. Okay, so these are the differential diagnoses of, in short, in case of mediastinal widening. In this patient also there is right-sided mild pleural effusion. So this may be a case of tuberculosis. As we don't know the clinical scenario, we know only the X-ray. So this is the first one. I think this X-ray will be working for you. The next one is very important. In this case also pause the video and make your diagnosis within maximum by 20 seconds. This is also X-ray chest PA view showing trachea central in position, cardiac shield is normal, diaphragm normal with funding gas shadow on the left side. There is no bony deformity, no soft tissue deformity. Costophrenic cardiophrenic angle on the both sides are quite normal, clear, but the definitive finding is the fine reticulonodular mottling or shadowing, whatever you say, fine reticulonodular shadow or mottling are seen all over the lung field on both sides. So actually this is a case of reticulonodular shadowing on X-ray, and mind it, the reticulonodular shadowing is very fine here, and actually it is called mottling. MOTTLING. So now the next question will be like this: what is the differential? What is the diagnosis? From your teacher, the question will be what is the diagnosis? But the answer will be not the diagnosis, rather differential diagnosis. That means you will put multiple answer, differential diagnosis, not single answer. So it is a case of reticulonodular shadowing and fine reticulonodular shadowing. I repeat again and again, as because it is a case of fine reticulonodular shadowing, not just reticulonodular shadowing. It is a fine reticulonodular shadowing, not reticulonodular shadowing. But when you will say the differential diagnosis, you will put all the possibility of reticulonodular shadowing. So what are the possibility or the causes of reticulonodular shadowing on X-ray? At number one, and as it is on the both sides, you may say it is disseminated tuberculosis. It may be. Actually, it is a case of miliary tuberculosis, and disseminated, of course. So regarding the X-ray finding, at first, number one, you may just say the tuberculosis or disseminated tuberculosis or miliary tuberculosis. Anyone is correct. Number two, sarcoidosis. Number three, DPLD, diffuse pulmonary lung disease. Number four, carcinomatosis. Okay, carcinomatosis. So I put just 4 options here. There are many more options, you know. So this is actually a case of disseminated tuberculosis, miliary tuberculosis. When the reticulonodular shadowing are very fine and mottling, that is very small nodule like this one over the lung field, then it is called miliary tuberculosis. So thank you very much.